So first up is my former colleague, Kathryn Smith, who's the Chief Executive of the Social Care Institute for Excellence, a national charity involved in evidence-based improvement in children's and adult social care. Kathryn started out at 15 as a care worker in a care home. She's worked in social care all of life as a real advocate for improvement in social care. So I'm looking forward to hearing from her. So I think I'm handing over now to Kathryn. Is that right? Okay, thank you.
Hi there. Hi, everybody. As Ewan said, my name's Kathryn Smith, and I'm the Chief Executive at SCIE, the Social Care Institute for Excellence. I'm actually doing this conference from a cafe in London because I've got a management team development day today, so hopefully we don't get disturbed by somebody shouting out somebody's food order or somebody walking behind me, but just apologise in advance if that does happen. So, as Ewan said, I started off in care very young, so I have been at the sharp end, very much like many of you will be working in home share, family by family or shared lives. So I was actually 13, Ewan, not 15 when I started in a care home. And I don't know if we could get the next slide up, please. And you can see the picture here of me in that care home when I was just a little bit older than 13. And to this day, I can still remember those three ladies' names there. So the lady in the orange is Doris, the lady in the middle is Elizabeth, and the lady on the end is Alice. And you know, I really enjoyed working in that care home. Obviously I did, I kept doing it, and Elizabeth was great at avoiding me getting in trouble from the homeowner when I was supposed to be cleaning the windows and I was chatting to the ladies instead. She used to give me the heads up if the manager was coming behind me. Of course, it's not legal for a 13-year-old to do this kind of work anymore. The Care Standards Act in 2000 saw to that. And for this and many other reasons, we might think that standards in care have improved greatly over the last 30 odd years. And in some respects they have. And we should rightly be proud of the difference that this will have made to people's experiences of receiving care and of living in care homes. However, in other respects, the very care and support that is so essential for people to live the lives that they want to live is no longer available. For example, we used to do the shopping for people if they couldn't get out and about. People could get home care support much earlier on. They could get access to a care home if they needed that. Even just the lady I was just talking about, Elizabeth, sat in the middle, didn't actually have any physical care needs. She was in the care home because she was lonely. We don't necessarily cater for that in the same way anymore. And due to decades of government cuts to social care budgets, for many people, access to the right support to stay at home or to stay in an environment that they would choose to stay in is not always available. There is a little bit of background noise behind me. Can you hear that, or is it okay? Is it okay? Good. These earphones are doing their job. Thank you. Okay, so next slide, please. So in terms of thinking about change and growth in adult social care, we've been talking about a shift to prevention for decades. For as long as I've been in social care, we've been talking about a shift to prevention. And there are many elements to the government's 10-year vision which we would support. So, for example, the focus on choice, voice, and supporting more people to live independent lives. Last year's government white paper on social care reforms opened up many opportunities for the sector, and I'm just going to mention a couple of those. So a shift in resources into community-based preventative models of care, strength-based practice being embedded, so looking at people's strengths first rather than the difficulties, and I'm going to come on to that again later. An investment in alternative approaches, extra care, home share, shared lives, local area coordination, and a micro provision of home care. And then care and support being co-produced with people who draw upon care. And a really good example here is SCIE's work with Kirklees, which used co-production for 2 projects. That was developing an integrated contact centre service for health and care, and also reviewing their direct payments policy, and they created a new co-production board. So some really good work there that showed how some of this stuff could be taken forward. And next slide, please. One of the areas that SCIE spent some time focusing on over the last couple of years is housing. And this is a big area where we need a radical reform in terms of housing with care, people being able to live in a place that works for them to receive their care and not being forced into an environment that's not the right environment for them. So what SCIE did is we ran a commission on the future of housing with care and support. And we during that commission, we looked at all forms of housing with care. That included shared lives and home share. And Richard Jones, in fact, the chair of Shared Lives Plus, was on our board for that. And the key findings that we had there was a need for local partnerships, of local long-term plan, a need for co-production, a shift of investment into alternatives, including shared lives, a real need for innovation and putting that investment into that innovation. And we found that people want a choice of housing options. The Commission recommended 7 principles to underpin all future housing options, including enabling choice, being person-centred and outcome-orientated, and being community connected, just to mention just 3 of those. The Commission's report included ambitious new recommendations on the future of housing with care and support published by SCIE, a vision and a roadmap for providing more options for housing with care and support for older people, a call for an ambitious long-term plan to improve housing with care and support for older people. And there was a report published by the Commission on the role in housing, the future of care and support. And in fact, I'm going to be speaking next week at the National Children and Adult Services Conference on where we are 1 year on from this report. Next slide, please. Some of the key work that we're looking at now is ready for reform, and this is considering where local authorities are in terms of their readiness to accept the reforms that are coming now with the white paper. So SCIE's worked with over 50 local authorities and many providers of support over the last 5 years. And we believe that now there is a real commitment to shift to a model of care away from an institutional-based reactive approach and towards a more community and strength-based approach. So we're currently helping local authorities to become ready to deliver the first wave of adult social care reforms later this year. And this is important work as the Department of Health and Social Care wants to understand how ready councils are to implement the reforms, especially the charging reforms, which you might have heard referred to as the fair cost of care, and the proposal for an £86,000 cap on personal care costs. And these reforms are the first key step in the government's 10-year vision for adult social care, and they were intended to take place from April 2023, as Ewan mentioned in the in his introduction. Who knows what the current politics might change to that, but that was the current intention. And these changes mean that more people might be financially eligible for some support. And another clear plank of the reforms is a programme of support for innovation and the scaling of new models of care, especially more care at home and in the community. And Shared Lives Plus, as you know, I don't need to tell you, fits well into this vision. Next slide, please. So I've mentioned strength-based leadership a couple of times, and this is something that SCIE feels very, very strongly about. And we've done a programme of work with the University of Birmingham to really roll this out. So we hear again and again from people who draw on services about the importance of person-centred care, the sort of care and support that we would want for our own loved ones. And this outcome has to be key to any plans for care reform. And particularly for older people, we know from our own research that the public often prefer to remain living at home or in their communities if they require social care. And frankly, wouldn't any of us say the same thing? You know, if you were asked where do you want to live to have your care, the majority of us would say, well, I want to stay living at home, please. But delivering these ambitions is going to require strong leadership, especially leaders who understand and can apply what we call strength-based approaches. And these approaches focus on people's strengths. So moving from what's wrong with you to what can you do. I've got a couple of examples that might help you to think about that. So there was one where there's a man who was isolated and depressed, and his social worker found out that he used to be a cook in the Navy. So she brought him in to cook in the social club. His mental health and well-being improved, as did everybody else's. Another example, a while ago I heard about a lady who had been supported for a kind of isolation, and when the support worker was working with her, she found out this lady used to be a swimming instructor, and the lady wanted to go back swimming. The support worker couldn't swim, so the lady volunteered to support her to swim. So they started going swimming together each week. The lady mental health well-being improved, she found a purpose again, and in fact the support worker gained from that as well. So a real example of strength-based leadership in practice there. So SCIE's working to develop social care leaders with these attributes, and our strength-based approaches leadership programme is proving really popular. And we also believe that strength-based approaches are central to the shared lives model. So thinking about what can you do rather than what's wrong with you promotes the values that underpin home share and community involvement. And next slide, please. And so this is my last slide and my last my last points really. I think, as has already been mentioned, this is going to be a very difficult year. We've had a few difficult years. It's going to be a very difficult year. The cost of living that Ewan has already mentioned, the issues we've got with recruitment in social care, and we heard just yesterday from the from Skills for Care that the social care workforce has seen a downturn for the first time in a long time. We've got real pressures on social care. We've got a lack of carer breaks, but nevertheless, where we are now, we've got real opportunities for real change and growth if we work together. We've got some real tangible evidence of things that are wrong and things that need fixing. And we also know what people want us to do to fix those things. So if we work together, I really believe that we can make the difference and we can help to start improving social care for those people that draw on it in the future. And that's all from me. Thank you very much.
Thank you, Kathryn. That was brilliant. Just one quick question for you. What do you think leaders need to be thinking about over the next couple of months as they head into another difficult winter? What would be the priorities for leaders in social care, do you think?
Nice to put me on the spot there. Well, I think the issue that I just mentioned there about the workforce is a really crucial question. How do we get people to come into the workforce? How do we get people when they're leaving school to want to come into social care? How do we retain our workforce? We can't wave a magic wand and bring lots of money into the system and suddenly change everybody's pay. So what can leaders do to support people to feel supported and empowered and able to make a difference? The majority of our workforce work in social care because we believe in making a difference. We want to make a difference and we are very driven by that. So how can we show people the difference we're making? How can we help people to see what impact they've had? And in fact, I was just telling somebody this anecdote yesterday. I took my son's girlfriend to college to enrol on a health and social care course a few weeks ago because she wants to be a social worker. She just left school. She wants to be a social worker. And at this enrolment, I was told that the college, when they found out where I worked, they thought that maybe I can help them because the college find it incredibly difficult to get placements for their students. Why are we not giving placements to our students? We all work in social care. If we want people to come into the system, if we want people to be care workers in the future, we have to give them some experience of what that looks like. So reach out, grow your networks and give that support so that we can grow the social care workforce into the future.
Fantastic. Thank you, Kathryn. Thank you very much for coming along today and giving that really helpful presentation, really great presentation. Thank you.